we're going to be learning about musculoskeletal and organ anatomy of the pelvis so that you can better understand how you function and what's going on with your body. Better able to make the connections to your pelvic floor, which is kind of a taboo area. They're muscles that are internal, so you don't get to see them. They're small, and they're muscles that are difficult to voluntarily control. So let's first understand what I'm asking you to do by looking at anatomy. Also, please appreciate how we are intricately knit together as human beings, and especially as females when you're studying this anatomy too. Here we have the bony anatomy of the female pelvis. We're looking at the pelvis from the front, so here's the front, sacrum in the back. The bony pelvis is made up of 3 big bones, one of each of these big wing bones on either side, connecting in the front, the pubic bone. In the back is a triangle-shaped sacrum with the coccyx at the tip. These 3 bones form the bowl of the pelvis as they are shaped in a ring. We're looking at the pelvic floor muscles as if a camera were underneath us and the lens was pointed straight up. So here's the bottom of the pelvic floor. The pubic bone is up top here. The coccyx is right here. The anus, vagina, and outlet for the urethra are here. I want you to appreciate the different layers of muscle here. Here we have the most superficial layer of muscle. This front triangle in the front. Deep to that layer are these back muscles here of the pelvic floor near the coccyx. The same view, but the deeper layers are removed. So here are the most superficial layers of muscle of the female pelvic floor. Notice how these around the vaginal opening and anal opening are ring shaped, so they control the sphincters. It is such a cool picture because you can really differentiate the layers of the pelvic floor and the hip muscles. Okay, so to orient you, picture a camera is behind you and down, looking up at your bottom. So here's your spine. We're looking up at the tailbone, the anus, and the vaginal openings. So here's that superficial layer in the front. The deeper layers are in the back. Notice how the hip muscles here intertwine with those deep layers. It's so important to have supple and strong hip muscles for a supple and strong pelvic floor. Notice the interaction of the ligaments with the pelvic floor. So perhaps if you have an SI dysfunction where this ligament is taut, that's going to really affect how your pelvic floor can function. It is a side view of the female pelvic anatomy with the organs included. So in the front here we have the pubic bone, in the back sacrum and coccyx with the large intestine sitting right in front of it, the uterus, and the bladder. Those muscles we were talking about, the sling or bowl of muscles, are located right in here. So when we perform a pelvic floor contraction, there's a closure of the sphincters and then a lift of this sling of muscles. Orient you to this illustration, we are looking at the front of the body. Here's the pubic bone, and here's the spine. The abdominal muscles superficially and the organs are removed. So we're looking at the body from the front view with the pubic bone here, spine and sacrum, coccyx in the back. The pelvic floor is in the bowl of the pelvis here. Obviously, we've been talking a lot about that, but I wanted to orient you to the hip muscles in the front. We had talked about hip muscles posteriorly in the back, but here's your big psoas muscle interconnecting with the diaphragm, which we'll be talking a lot more in our time together. This big, thin, dome-shaped muscle housed up in the rib cage. Very important for our human survival. Here's a picture representing the intra-abdominal piston with the diaphragm on top, the transverse abdominis, and then the pelvic floor muscles on the bottom. These small muscles in the spine are called multifidi, and they're also stabilizing muscles, as is the transverse abdominis here. So when we breathe, the diaphragm is moving up and down, the piston up and down type motion. When we inhale, the diaphragm goes down, descends, as should our pelvic floor. When we passively exhale, the pelvic floor may contract so that we have a balanced, synchronized system working together. That's our piston. Okay, now that we know a little bit more about the anatomy of the pelvic floor, let's talk about the details of a pelvic floor contraction and relaxation. We know that the superficial muscles of the pelvic floor have those sphincter shapes. The deeper muscles striate from front to back, and they cause, when they're contracted, they cause a lifting motion. So when we're cued to perform a pelvic floor contraction, we're first going to think of bringing the sphincter muscles together and then creating a lift. A fun way to remember it is the elevator doors are closing and then lifting. After you perform a pelvic floor contraction, when the pelvic floor is lifted, lower the elevator and feel a descent of the pelvic floor and then a slight opening. Sitting is a great position to practice contracting and relaxing your pelvic floor. We're going to find a hard surface, so a chair, or the arm of your couch works great because we want to have our hips higher than our knees. So have a seat. We're going to start by doing some pelvic rocking. Let's palpate the sides of the pelvis. Our hands guide our pelvis to rock forward and backward. Nice and slow, becoming mindful of the sensations on the chair. So forward, might need to open your knees. Feel the pubic bone area. Slowly rocking backwards to contact the coccyx to the chair. Up and over the sit bones. Feel 2 bony points, one on each side. Forward. The bowl of the pelvis rocks backward. Naturally, the spine curves also. Up and over the sit bones, forward. Let's palpate the coccyx on the way back this time. And feel even the coccyx in your hand touch the hard surface of the chair. One more time, forward. Hands relaxed to the side. Now, finding somewhere in between where our sit bones are maximally contacting the floor. We're balanced. We're in a neutral, efficient posture. This is the best place to activate and relax our pelvic floor. Let's stack our rib cage right over our pelvis and our head right over our rib cage for an optimal functioning posture. Continuing, let's become aware of our breath. Closing the eyes if necessary. Relaxing the jaw and shoulders. Notice where your breath resides. Is it in the upper chest? Do you find your breath in your belly today? Just noticing, just becoming aware. Taking it a step further, let's, with an inhale, feel the descent of the pelvic floor. Naturally exhaling, then inhaling, use that chair to feel a relaxation, opening of the pelvic floor. Next inhale, passively opening. All right, with your exhale, feeling a closure and then lift away from the chair. Relaxing the pelvic floor, inhale. Exhale, we're going to contract. Closing, lifting away from the hard surface. Inhaling, relaxing. Exhaling, feel the pelvic floor lift away from the chair. This is biofeedback. For many of us, that was a great exercise in self-awareness, pelvic floor awareness, and we felt connected to our pelvic floor muscles. For many of us, that was a challenge. We may not feel like we know what we're doing at all after those instructions. One more cue that I want to mention is cutting off the flow of urine. I feel like that's a safe way to practice using your pelvic floor muscles. I'd recommend trying to cut off the flow of urine at the end of your stream. If you can cut off the flow, those are your pelvic floor muscles. So store that one in your brain and come back to this exercise and try again. I encourage you to keep practicing now that you know the basics of performing a pelvic floor contraction and relaxation. Anytime you're sitting on a hard surface, you can go ahead and practice. The more times you make the neuromuscular connections, the better it will become ingrained in your body and the more success you'll have.